Hello, I'm Kathy. I'm one of the practice nurses here at Wincanton Health Centre, and I'm here to help answer some questions about respiratory syncytial virus vaccination for patients 75 and older. I think patients can get quite overwhelmed because during winter there are a lot of vaccines that are offered. So it's important to explain what RSV is and why it's important to have the vaccination. A lot of people just think RSV is another virus. Other people don't know what it is at all. Respiratory syncytial virus has been around for a while. They first discovered it in the 50s, but really the last 10 years is when we've made great strides, and now we have this vaccination. So it has been offered to pregnant women who are 28 weeks plus, and now it's offered to patients that are over 75 years old because they've been identified as being more vulnerable. In addition to this, if they've got pre-existing health conditions such as asthma and COPD, they're even more vulnerable and at risk. Common signs and symptoms would be a cough, perhaps a runny nose, feeling very chesty, temperature, perhaps. It is viral, so it's spread through droplets. And then in older patients or more vulnerable patients, it can become a lot worse in terms of you might struggle to breathe. So it can be very, very dangerous, especially in vulnerable patients. Over 75s and pregnant women are considered vulnerable. Obviously, when you're older, the body wears out a bit more, and we have a lot more pre-existing health conditions, which can all be made worse when we pick up viruses and certain bacteria. So it's very important to have vaccinations to protect ourselves as much as possible. Yes, we have a lot of patients that say this. They may or may not be healthy, but nobody knows how the body is going to react to RSV. Hopefully the body would fight it off, but there is a chance that it could go on to develop into more sinister illness. So it is still important, even if you are healthy, to become vaccinated. Hospitalisation. Pneumonia is the one we worry about. Obviously that can be lethal. So that would be patients with pre-existing lung conditions or heart conditions, obviously the vulnerable, which are pregnant women, young infants under 2, and people who are 75 and older. So the most frequent question probably is side effects. So then I would tell a patient that they might get a sore arm for a few days because it's an intramuscular injection. Occasionally they can feel a little bit achy with it, even develop a temperature, but those are more rare side effects. Most of the time it's just a sore arm. We also have to let them know that they have a slightly increased risk of developing something called Guillain-Barré syndrome, which is a nervous disorder whereby the immune system attacks the nerves in the body. It's extremely rare, but we just have to let the patient know about it. Well, I would say to you that it's quite common to be nervous to have a vaccination, but that you would only need one RSV vaccination. It doesn't always stop you getting RSV again, but it would give you a much lesser severity and hopefully prevent pneumonia and hospitalisation.